Hi, I'm Mackenzie Rex, and today I'm here to talk to you about mandated reporting for child abuse. So starting at the top of the government in the United States, we have Federal Act of CAPTA, which is the Child Abuse Prevention and Treatment Act. This act started in 1978 as a guideline for adoption and when children can be removed from the home in the case of abuse or neglect. The current statute has been updated as recently as 2010, and this act also provides funding to states that fit certain criteria. This requires states to screen, identify, and prevent child abuse. Now that screening process starts with mandated reporters. According to CAPTA, mandated reporting is required to receive funding. Kansas is one of the 47 states that has agreed to mandate reporters as well as follow the other guidelines, as well as all of the United States territories who do that as well. Identifying means putting that report in, and preventing child abuse basically means that CPS follows up and provides some sort of intervention, has a plan or an outline for different kinds of abuse. So CAPTA basically interacts with the state level and puts the responsibility on the state. Kansas, like I mentioned, is one of those states. They designate a Class B misdemeanor for failing to report any sort of knowing abuse or neglect that is known or suspected, as well as knowingly providing a false report. It is something to note that across the United States, according to CPS, no reports of knowingly false or that were knowingly falsely put in were reported in the 2018 study. It's something to note also as a nurse that it is appropriate and necessary to provide otherwise protected medical information to law enforcement during an investigation. That means that you cooperate fully with the law, and information about physical assessment or statements made by the patient or family members should be provided to the investigators during the whole process, whether that means, being interviewed by police or testifying in court. I think it's important to point out that there is not a specific demographic of children affected by child abuse and neglect. It happens on all socioeconomic levels. It happens to all races. It really happens around the world, unfortunately. So you cannot look at somebody and know they're the one that I suspect in any certain way. Demographically in the United States, white children are most affected by abuse as far as numbers go, followed by Hispanic, and then the third most is African American children. This is strictly a numbers scale. When you look at it as far as rates per 1,000 children of the same race, Alaskan and Native children have the highest rate, followed by African Americans. And that is according to Child Welfare, who gather their data from CPS. Birth to 1 year is most frequently abused group, and the most frequent type of abuse is neglect, which makes sense when you consider that age group is the highest. I think neglect was about 60%. And so in that birth to 1 year, these parents aren't used to caring for a child and putting a child before themselves. So it makes sense that neglect is the highest type of abuse by far. Physical abuse is just slightly ahead of sexual abuse, and both of those are slightly less than 10%. Other sorts of abuse include psychological abuse and medical abuse, as well as other forms of abuse, which include like witnessing the abuse of a parent or witnessing substance abuse in the home. These are much less common, but still worth mentioning. So I'm just going to brush over some of these studies that I found very interesting. I think it's worth mentioning that outcome studies were very hard to find in this case. It's not similar to an ELISA test where you can look at, the percentage of false negatives or the percentage that screened positive after this many months versus a year later. So process studies were more common in this case. The McTavish study particularly set out to look at the effects of mandated reporting in a meta-analysis and instead changed routes and went to a meta-synthesis of qualitative data. They found that some of the struggles professionals face, especially healthcare professionals and nurses, were that they didn't feel that reporting benefited the child. They felt that a lot of the children that they reported were overlooked. They felt that sometimes the child is taken from the home only to be put in a worse situation in a foster home. And some reports even included that death to the child had occurred, whether it was before the child was seized by the state because the parents knew that that was going to happen, or whether they died in some mysterious way in foster care. So some serious issues with reporting occur with some of the healthcare providers. Another really interesting point this study made was that only 13% of nurses experienced a positive experience with reporting, where 73% of nurses reported a negative response with reporting, whether that means that they found that the child ended up in a worse situation, or that the process was too murky, or whatever occurred. They felt that by reporting, something negative had occurred, whether to them or to the child. Next up, I'll talk about the Turner study. This study looked at different interventions to increase the rates of reporting in nursing. They looked at training and education styles and how those affected, and they found that all were generally effective in increasing the rates of reporting in nursing staff. They also found that as time went on past the education or training, those rates tended to decrease to baseline. So this supports that it's important to continually reinforce that training or education, and just to remind healthcare providers that it is important and impactful that they screen these patients. It also found that the more resources and the more information that they had for their patients that disclosed abuse to them, the more likely nurses were to report, because they felt hopeful about the outcomes if they did report. Lastly is the Foster study. This study found that nurses did feel committed to reporting abuse and neglect, but that they did not perceive any negative consequences for reporting the abuse, so they did not necessarily feel like they were punished at their job, or like that it was a really hard thing to do or anything like that, but they were concerned overall with the ability of the system to handle the children that they reported, and they felt that oftentimes those children were overlooked, or that they, screened the children negative when maybe they thought the children should have been a positive screen for domestic abuse and warranted more of a investigation than what they got. So that in itself can be a negative reinforcement for nurses to put in reports when they feel that they're doing it for nothing. So when I say there were very few outcome studies, I mean there were very few. I searched several databases extensively and was able to come up with one. This Matthews study looked at the impact of mandated reporting after a law was passed in Australia that mandated reporters for the first time. This title states it's a 7-year study. All of the data that I found in this study was after a 4-year increment. This study specifically looked at sexual abuse in children, and before legislation, an average of 662 cases were reported per year. After legislation, that number increased to around 2,448. Of that, the number that necessitated further investigation went from the pre-law 451 to post-law 1,363 in a 4-year period, and cases that were found to be, actually persecuted sexual abuse went from 160 on average per year to 327 in that 4-year period, which is a substantial increase. That's more than double. So it does say that mandating reporting is effective. So looking at this at face value, it seems pretty obvious. It's free to screen the patients that are already in the ER or already in pediatrics for care. But when you consider the less monetary value, it becomes a little bit more complex. So when you think about the stress that families undergo when they are reported and investigated, or the cost of the intervention that it takes to see those families, or the stress to the nurse reporting that event, or Whether this claim will come back to haunt the medical provider or if they'll see some sort of terrible outcome for this child, that takes a substantial stress toll. There's also a monetary toll when patients are taken, or rather children are taken from the home and put into foster care or put up for adoption. There's a significant cost to the state for that. So I'm going to go through this quickly. As far as hazard identification, it's clear that children who are being abused have a significant risk and are put at the risk of physical, emotional, and potentially death if we are not careful due to their environment. Dose response assessment, again, it's pretty clear that the more abuse faced by the child or the more severe the abuse, the more global the impact on their child's life. The exposure assessment, although ideally all abuse would be reported and investigated, that's just not possible with the resources that are currently available in the United States. So unfortunately, the more severe cases tend to get noticed while the more overt cases tend to be looked over. And risk characterization, the abuse and neglect impact development, and that can really impact the entire life of the child. So it is very imperative that we see these children. So to wrap up, mandated reporting does increase the number of reports a year that are filed. Those reports do go on to yield more substantiated cases of abuse, but there are serious barriers that nurses face to reporting, and abuse is still underreported.